Obamacare subsidy. And the question is whether or not we should continue those crazy subsidies that are costing a lot of money that we really can't afford to spend. Tommy Aiello joins me now, Senior Director of Government Affairs at the National Taxpayers Union. Tommy, welcome back.
Good evening. Thanks for having me.
What should we do with these Obamacare subsidies? And I want you to get down to some of the practical examples of this, because I think people think, well, this is just for very, very desperately poor people. But that's not the way Obamacare was set up, was it?
No, it wasn't. So right now there's a debate going on in Congress about whether they're going to extend something called the enhanced premium tax credits.
Yes.
You rightly pointed out that it's an Obamacare subsidy. It started out because of Obamacare. But in 2021, under President Biden, the Democrats, and only the Democrats, as part of their temporary COVID spending spree, they expanded it to include people up to 400% of the federal poverty line. And there's been all these loopholes included in it that people making up to $500,000 a year are eligible for these tax credits. And it is an expensive tax credit at that. It costs the federal government about $40 billion a year, and it's up for an extension at the end of the year. We think Republicans should hold the line on Obamacare subsidies and temporary COVID measures. There's no reason to extend it.
Well, in fact, if they don't, why would Republicans agree to extend these things? And are they just buying time, or they're cowards because they aren't willing to make the tough decisions that a country with this much debt should be making right now, or what?
I mean, when Congress got back last week, especially here in the Beltway, there has been an onslaught of ads and a pressure campaign urging Republicans to extend it. And I think what the special interest groups that are pushing for these temporary COVID measures to be extended is obviously a financial windfall for them. But they want to pressure Republicans who think they might be a little vulnerable to the healthcare debate. And they want to pressure them, saying it's going to hurt your reelection chances if you extend these temporary COVID programs. Now, I think when we talk about Republicans and conservatives, we should all agree that Obamacare has been a disaster. We should all agree that the COVID spending spree led to this inflation. There's no reason that this program should continue. And we're really urging to Republicans, hold the line. Everything is going to be okay. Perhaps your reelection might be a little tricky next year, but it's not going to be because of these temporary COVID programs.
Well, and not if you actually explain to people what it's doing, because once again, I think the public perception of Obamacare is this was all just for the very poorest people in America. But in fact, it wasn't. And the expansion of Medicaid under Obamacare was a real disaster. And a lot of people forget that when they actually did a study and said, hey, let's take a look at 30,000 people who just got Medicaid, and let's take a look at 30,000 people who were also on the list to get it, but they didn't make the cut. And at the end of a year, they said, how did their health outcomes change? And they said, not much. So in other words, being on Medicaid or being not on Medicaid, about the same health outcomes altogether. And you say, well, that doesn't make sense, because if those people took advantage of having access to a doctor and a pharmacy and being able to go in for proactive things, it should have changed their health outcomes gigantically. That study they did, and it involved a big enough group, 60,000 people in total. And, it's been written about by just about everybody. I think it was actually Harvard that did it, although I don't trust Harvard that much. But they said, we looked at two groups, the control group and the test group. And at the end of the year, they were both about the same. Their health outcomes had not changed at all, even though one set of 30,000 had Medicaid cards, the other side did not, and they both came out about the same. So it had no benefit.
Yeah, you're exactly right. Not only are the benefits not improving for people's health, but if you just look at healthcare costs, right? We call it Obamacare, but it's the Affordable Care Act. That's the actual name of the law. Healthcare has gotten no less affordable now compared to 2010.
Or no more affordable.
Yeah, right. No more affordable than 2010. And when you take into account that these enhanced premium tax credits, they're saying the sky is going to fall if they're not extended. Healthcare premiums, they go up every single year, unfortunately. That's just the nature of things. Now, if you get rid of these subsidies, Obamacare, yes, it might get a little bit more expensive. We understand that. But unfortunately, when we're $37 trillion in debt, running $2 trillion a year deficits, maybe we should get the government out of the business of healthcare and let the free market actually work itself out. In that case, one, we'll have more competition, we'll be able to lower prices, and healthcare options might actually increase for people, right? We've been saying for 15 years Obamacare has been a disaster. It's time that we start living it, taking it seriously, and taking those steps to try and peel it back little by little. And we think that this premium tax credit is a good place to start.
Okay, and you know what I'd like to see, Tommy? I would like to see, I'm not an insurance expert, but if you said, look, what would actually benefit people the most? The scare tactics that they used to push Obamacare through with not a single Republican vote on either side, House or Senate. They said, well, you might lose your house. You might go bankrupt. I said, fine, let people buy, low cost, catastrophic health care. So in other words, it covers you for catastrophe, a very bad car accident that really messes you up, or a heart attack or cancer or whatever. You can buy that, and you could buy it then, and I think you could buy it under the current system if you said, that's all I want to be covered for, the catastrophes, day-to-day stuff, go and see the doctor, I'll pay out of pocket, I'll keep myself healthy. When they do that, people end up being, concerned about what the costs are if they're paying it out of their own pocket. If they're saying, well, the insurance company's paying, well, then the hospitals and the clinics are free to charge anything they want. And I think CAT scans and things like that are a great example. You walk in and say, how much is a CAT scan? And the hospital says $3,000. You say, well, I can find it elsewhere for $500, same CAT scan. And you say, but why can you charge $3,000? Because our customers don't care. It'd be like walking into a restaurant and saying, well, I'm trying to decide between a salad and a steak. Well, they both cost the same. Okay, then I'll have the steak. That's how it works.
Yeah, no, it's the truth. And, insurers want these premium tax credits to stay in law, because how it works is when people pay for their premiums, specifically for this program, they get a tax credit dollar for dollar. So basically, whatever money they spend, it doesn't stay in their pocket. It gets passed along to the insurers. So really what this is a big cash grab for the insurers, and that's why they're putting so much pressure out there. And then when you look at the specifics of the program, it's riddled with fraud. It has a fraud rate of 26%.
Whoa.
It's the highest. It's ridiculously high. Now, that 26%, it's the highest fraud rate out of any government-funded healthcare program. 26%. One in every $4.
$1.04 is going into some fraudster's pocket. Tommy, thanks very much. That's Tommy Aiello. He's Senior Director of Government Affairs of the National Taxpayers Union. Glad to have you on.